Now, the COVID-19 pandemic is raising the risk of strokes with fewer opportunities for exercise and more people working from home. One study found that sedentary individuals were as much as 30% more likely to suffer a stroke than their more active peers. And so this year's National Stroke Campaign is putting the spotlight on acting fast when the condition strikes. And for more, we are joined by Associate Professor Deidre and Silva from the National Neuroscience Institute. So, Professor, let's touch on your campaign spotlight, which is on about acting fast. So how fast are we talking about? How critical is this response time during a stroke?
So really, it's as fast as possible. And the campaign message this year is timing is everything. And the key thing to remember is that every minute that passes, brain cells are dying. And for every minute that a stroke goes untreated, 12 million brain cells die. And therefore, it's critical that people recognize the symptoms of stroke, take the appropriate action of calling for an ambulance, and then getting to hospital and getting prompt treatment. And with that, we know that early recovery is more likely when treatment is received in a very prompt manner.
Professor Deidre, so, time is of the essence when recognizing that a stroke has actually occurred. So how can people help?
So really, it's remembering the symptoms of stroke, and we use the mnemonic FAST, which is really quite apt, saying that we really need to really act quickly. And FAST stands for face, drooping on one side, arm weakness, speech difficulty, and T is time to call 995. And we give that advice of calling for an ambulance because that's the fastest way to get to a hospital. The paramedics will be able to recognize the symptoms of stroke and en route call the hospital. And therefore, the stroke team is ready to accept the patient, assess them, and treat them as quickly as possible. So really, if you know or you see somebody who is suffering from a stroke, or if you yourself are experiencing any of those symptoms, call for an ambulance. In the meantime, we advise that you don't eat or drink because you could choke because swallowing may be affected. You may want to gather your medications together because that might be something the doctors may ask for. You should keep safe and wait for the paramedics to come.
Now, we've mentioned that, sedentary individuals are more likely, to get a stroke. But what other trends are you seeing in terms of the stroke incidences here? And which are the areas that you're particularly concerned about?
So what we're seeing is over the last 10 years that the stroke numbers have actually increased in Singapore. And this is predominantly because of our aging population. When we standardize for age, meaning taking into account the aging population, actually the incidence is about the same. But we are seeing a rising trend of stroke in the younger age groups, in 40 to 49-year-olds and 50 to 59-year-olds. And that's something that should be addressed because 80% of stroke are preventable. And so we hope that individuals will take the measures that they can take to reduce their risk of stroke. And that includes going for regular screening for stroke risk factors like high blood pressure, high cholesterol, and diabetes, as well as having healthy life measures. So stop smoking if you smoke, and if you don't, please don't start. Exercise regularly. You talked about the sedentary lifestyle, and that's a major issue. People need to keep active, keep a healthy body weight. And all of those things will reduce your risk of stroke significantly.
Professor, the campaign is also calling attention to mini strokes or transient ischemic attacks. What are the signs of these, though?
So transient ischemic attack, or TIAs, are exactly the same in terms of the symptoms of stroke. But the symptoms resolve completely after a few minutes. And this is because the blood flow to the affected brain is reestablished. And so the brain cells are salvaged and they don't go on to die. But they are a warning that stroke may happen. And it's a very high risk of stroke subsequently, up to about 10% in the highest risk group. And about 20 to 30% of patients who present with stroke, actually, if you ask them, they will have had a transient ischemic attack recently. Now, if you have a TIA symptom and it resolves or it seems to be resolving, you still need to act fast and come in. If we can assess you, we can assess your risk factors, we can put you on medication to reduce your risk before the stroke occurs. And so that's why we really want to tell people that as soon as you have the symptoms, call for the ambulance. Even if you think the symptoms are improving or if they have completely resolved, still call for the ambulance because we want to prevent the stroke from occurring after this transient ischemic attack.
Now, Professor, there's a group of people that I think we don't talk enough about, and I'm talking about the caregivers of stroke survivors. And I'm wondering, how has, the pandemic affected them, and how can we help them even more?
So, the caregivers are big heroes, right? They play such an essential role to stroke survivors and their recovery journey, but they also need care. Up to 40% of stroke caregivers actually suffer from depression, and about 20% suffer from anxiety. There's a lot of caregiver burden, and there's a lot of caregiver fatigue. And I think with the COVID pandemic, it sometimes becomes a little bit harder because, we may not have people and family around as much as we would have had without some of these measures that we have to adhere to now. But there are some ways that we can help. I think for caregivers, if you're a new caregiver for a stroke survivor, one of the key things is to get yourself the information that you need and to help you to understand the situation and to know what are the resources available to you. So you can get that information. One good resource is Stroke Hub, which is on Health Hub from the Health Promotion Board. There's also an app, which is a free app, which is called Stroke Buddy. And both these resources have validated information as well as tools to help caregivers. I think the other major thing is getting support. So obviously, friends and family are very important, and you should, as a caregiver, share your burden with other individuals because then it eases it. And then there are also support groups. So the Stroke Support Station and the Singapore National Stroke Association have caregiver support groups, have programs not just for stroke survivors, but also for stroke caregivers. And this, I find, for many of the people I speak to, helps them dealing with the burden of caregiving.
Well, thanks very much for sharing with us on stroke awareness. We've been speaking with Associate Professor Deidre and De Silva from the National Neuroscience Institute.